Welcome, everybody. You're listening to the Maximize Living Radio Show. My name is Dr. Nick Barnes. I'm your host and also the owner of Health From Within Family Chiropractic. We're a local health center here in the St. Louis region, bringing you guys truth about health and healing over the airwaves. And we have an amazing show planned for you today. It's been incredible seeing our followers and our listeners texting in, calling in, emailing in requests on for things that we should be speaking about, topics that we should be covering. And what's the underlying tone has been that people are realizing that they have to take responsibility for their health right now in our culture. We've been really fed a lot of lies when it comes to who's responsible for our health. That whether it's your genetics, whether it's your age. But I'm here to tell you guys that the person responsible for their health is you. It's ourselves, right? The best doctor in the world is inside of you, and so we realize that. Your body's designed to heal. It desires to heal. We know that you are fearfully and wonderfully made, but many times that belief system and that truth and that fact is not supported by our actions and by our lifestyle. And so with every single week on the show, I want to make sure that people understand that there's things that we can be doing today that's going to impact our health in a positive way for tomorrow. And so, of course, everything we do is going to either move our health in the right direction or the wrong direction. And so with this show and what we're doing on Facebook, with what we're doing in the community is that I want to put the power of choice when it comes to your health back into your own hands so that you can yield better and greater results than most people in our culture. Because at the end of the day, we have to be counterculture. We got to be doing something completely opposite when it comes to our healthcare model, because guess what? It's not currently working. We have the best doctors, nurses, surgeons, the best access to medication, the best access to surgeries here, even in our city compared to other places in the world. And so what's happening is that although we have the best access to health care, I would say sick care and crisis care in our culture, that the numbers are not getting better when it comes to chronic illness. So heart disease, cancer, diabetes, these numbers are going up. They're not going down. We know the levels of prescription medication usage is going up. We know the numbers of surgeries are going up. And we just realize that there's money in sickness. There's money in being unwell. And so what we need to do is we start to focus our resources and our time and our energy on being counterculture when it comes to our healthcare. So really be focused on health promotion. And so we got to realize that getting healthy isn't always going to be convenient. We understand that getting healthy isn't always going to be comfortable. And we know that getting healthy is going to require some sort of investment of time and finances, because at the end of the day, we're going to spend our time, money, energy, finances on either getting healthy on our own terms or on crisis and sick care. And so my hope and prayer is that we never have to go into the crisis and sick care model, because we're so healthy that we can avoid it as long as we possibly can. That is our goal, right? And so we want to make sure that you experience health and healing without drugs or surgery for as long as you possibly can. And unfortunately, in our culture, we're just not taught that that's possible. And so what we do in our clinic and what we teach in the community and over the radio is we want to focus on the 5 essentials of health and healing. There are 5 essentials when it comes to health promotion, right? These are not just 5 good ideas, but they're essential for your health. Number 1 is our mindset. What is your mindset like when it comes to our healthcare and how you're taking control of your health, right? Do you believe that you're broken? Do you believe that your organs are just pieced together, or do you believe that your body is a healing machine and that it's always wanting to work for you, never against you? Right now, our mindsets are being affected by the media and what's currently occurring with the crisis that's happening out there. In the last month or so, we've been really hitting the virus and virus prevention and what you can do to avoid the chaos that's occurring out there, and what responsibility can you play? We've been talking about that a lot. So this week we're going to take a break from that, but just, our mindset still has to be protected, right? If we're going to be operating out of fear, we will not ever push the needle in the right direction when it comes to health. And actually, if we're operating out of fear, that creates a negative hormonal response, causing more illness, more sickness, and a more weakened immune system. And it's interesting right now when it comes to our mindset, how much judgment that's currently happening out there, whether it's on Facebook, whether it's on Instagram, whether it's from family members or friends or other businesses, whatever it is, guys. And I'm here to tell you that we have to bring the judgment level down. At the end of the day, it's not going to win. It's going to cause more divisiveness, and therefore people are going to keep pushing away from each other. And therefore, if we're going to be more secluded and more fearful and more from a judgment level, then we're going to lose heart, and we're going to forget what it's like to actually be well and healthy on our own terms and be responsible for that. And so I want to make sure that we as a culture, we start to say our mindset has to be protected, our heart has to be protected. Number 2 is our nervous system. Is your spine healthy, and do you take care of it? If you think chiropractic is just a luxury, or maybe go when you hurt, that you're completely misguided and miseducated. Chiropractic is essential for your health and healing. Your spine was given to you to protect your spinal cord and nervous system. The brain sends signals down the spinal cord across the nerve roots that branch out of your spine and that go to every single cell, tissue, and organ in your body. So right now, for your heart to beat, for your lungs to breathe, for your stomach to digest food, your brain controls it all. And we are literally hardwired. We are not Bluetooth, but we are literally hardwired. And so once we understand that to be the truth, which it is the truth, then we understand our spine must be in the proper position in order for the signals to get from the brain to the body. And so our spine must be straight up and down from the back. Our hips must be even. Our shoulders must be even. And from the side, we must have 345-degree curves. If those curvatures have been lost, or there's damage in the disc spacing, bone spurring, arthritis, whatever it is, putting damaging pressure on those nerves, there's no way our body can fully heal and function. If we have a minor scoliosis or severe scoliosis, or one hip is higher than the other, or let's say one shoulder is higher than the other, there's no way structurally things are going to be sound. And so when your structure is off in your spine, the function is off in your nervous system. When the function is not working when your function is not working in your nervous system, the body's going to create symptoms, sickness, and disease. And so at the end of the day, when it comes to chiropractic, we got to recognize that it's all about starting with the healthy structure of the spinal column. And then we have to focus on the function of the nervous system, which then in turn allows our body to heal and function at 100%. That is what chiropractic does, is we remove interference with the nervous system, allowing the body to do what it's supposed to do, which is just that, which is heal, right? Which is heal. So that's number 2. Number 3 is you got to eat clean food, right? We got to get more nutrients, and then get more minerals into our system, whether it's through supplementation, whether it's through food, whether it's through smoothies, whatever the case may be. I want you to recognize that in our culture, we're not getting enough healthy, quality, nutrient-dense food in our diets, and therefore we are nutrient deprived. And so therefore it leaves us going down this path of always being hungry for junk food, right? Or for nutrient-deprived food. And so we got to make sure we're getting enough nutrient-rich food in our diet. And also we got to make sure we're supplementing with the right supplements, not just the run-of-the-mill, whatever you find at Walgreens or whatever convenience store you find, right? Number 4 is you got to make sure you're exercising. We have to exercise day in, day out. Why? Because our heart rate needs to be increased. Our lungs have to be opened up. We have to get oxygen to the system, and we should be sweating every day. Why? As a form of detox, as a form of lymphatic function, and you got to move your body. You're giving your joints to move, so let's get up and move them. Number 5 is minimize chemicals and minimize toxicity. This is when we start to look at our environment, and what we're putting on our skin, what we're breathing in, the type of water we're drinking, whatever the case may be. There's toxins that are just detrimental to our lifestyle, to our body. And I think one of the things that we've kind of been numb to is the fact that all these new products are coming out that are unhealthy for our home or for our body. And we just think it's okay. But I'm here to tell you that you have to be your own advocate when it comes to detoxing. You got to start to look at your lifestyle and look and see what you're currently putting on your body, or what you're using in your home to clean. And so we got to make sure we're detoxing. If you don't detox, then you're missing the big component of health and healing, right? And so what I'll tell you guys is this: as we have people listening to the show, and that I want to make sure you know that this is not just your typical run-of-the-mill health show, right? Literally, my heart and my patients and my team's heart for you is to see you experience health abundantly, so that you don't have to be limited in your life, so you actually can have a quality of life, right? A quality of life. And so we have a few testimonies we're going to share today. The reason that we share testimonies on every show is because I want you to hear that there's hope. And my hope is that you guys will have the opportunity to actually experience true health and healing. And usually there's 3 camps of people, right? And I want you to determine which camp you're in, right? One camp is you've been living this healthy lifestyle. You realize it's a lifestyle. You realize it's not a diet. It's not just a 30-day, reboot program, but literally you've been living this healthy lifestyle for years now, and you're proactive with your health, right? Some of you are in the other camp where you haven't been living a healthy lifestyle, maybe because you weren't educated to, maybe because you didn't know where to go or how to. And maybe you're on multiple medications, maybe you have multiple surgeries, maybe you've just been given this prescription of hopelessness by the medical model that you'll always have this symptom because it just runs in your genes, okay? Which is mostly a lie, depending on the diagnosis, right? So maybe you're in that camp, and I'm telling you that there's hope for you. But this third camp is where I find a lot of people, where people like want to be healthy, but they don't really know how to get there. But they also rely on their medication to get through the day or the week or the month. And so what I'll tell you is that in either camp, there's always room for improvement. Why? Because getting healthy is not an arrival point. There's not just it's not a destination. It's the journey that's going to get us there, right? And so even for myself and team and family, that we're always trying to take it to the next level when it comes to our health. And we're never just, hey, I think I'm healthy, so I'm just going to stop now, right? No one does that. No one says that. No one says, yeah, I've eaten healthy long enough, so I'm just going to stop eating healthy, right? So I'm here to tell you that no matter what camp you're in, there's room for improvement always. And it just starts with recognizing that, right? Understanding that, hey, maybe I've ignored this essential of my health. Maybe I should do something different, right? And one of those people that was doing a lot of things right in her health, her name is Lisa. Lisa came to our clinic. And she was, I would say she's an athlete. She worked out 5 to 6 days a week. She was taking amazing supplements. She looked like the picture of health from the outside. And so I asked Lisa, like, so Lisa, what brings you into the clinic? She goes, well, Dr. Nick, I've been doing everything right. I'm with one of the best trainers here in the area. I'm doing keto, paleo diet at 90% of the time. I'm taking these supplements. I'm trying to get more sleep. I'm trying to detox. I've changed all my products. She goes, but for some reason, I keep having these horrible headaches. And I keep having these migraines. I'm getting about 3 migraines a week. And what's happening is that as I get older, and she was in her mid 40s, as I get older, it keeps getting worse. It's not getting better. And so Lisa's like, this doesn't make sense. I'm doing everything right in my lifestyle, but I seem to can't get over these migraines. And I go, has anybody ever looked at your spine? She goes, no one's ever looked at my spine. And so from the side of the neck, if you guys are familiar with this, you must have a 45-degree curve from the side of your neck. It must be the shape of a C or a banana. And what happened is that Lisa's neck had never been x-rayed. She'd never had an exam of her spine because she was taught that chiropractic is for neck pain. And guess what? She didn't have neck pain. But being an athlete, being active all the time, we knew there could be some damage in her spine. And so we x-rayed her neck. From the side of her neck, the curve should be at a 45-degree curvature. She had lost 50% of the curvature in her cervical spine, which is putting damaging pressure on the nerves, the disc spaces, and the joints, causing arthritis and degeneration. Now, what's interesting is those same nerves are branching off and going to her head, causing her headaches. So we actually found the cause of her problem, and we started to adjust her spine through chiropractic care and spinal rehab to help hold the adjustments longer. And what's amazing is within 2 months, Lisa's headaches were 100% resolved. Her migraines are completely gone. She went from having 3 migraines a week to now she has no migraines. She's still getting adjusted. She's still doing her rehab. She's still living her healthy lifestyle, but now she's implemented chiropractic care into her health promotion routine, into her essentials, and now she's living her life fully without medications. And she says, I can be a better mom, I can be a better wife because now I don't have migraines. And so how many people out there are listening right now who have migraines and they don't know where to go? If you're listening right now, you're like, I need to know where to go. My office is called Health from Within Family Chiropractic. We're located in Rock Hill, Missouri, at the corner of Manchester and McKnight. Normally, for a new patient to come into our clinic, it's $150. But if you're listening to the show right now and you call in right now, it's only $60. Literally, you save $90 by calling into the show right now. That includes your entire new patient appointment and your full set of x-rays. This is the catch. You got to call now. When you call, I will schedule you. We'll take the $60 payment over the phone. That way, when you come in, there's no additional cost whatsoever. The number to call right now is 314-323-7214. 314-323-7214. We'll be right back after the break. Hey, Facebook, thanks so much for tuning in. Keep commenting. Tell me where you're listening from, watching from. I know this is reaching thousands of people across the country and so even across the world. So let me know where you're listening from. Give us a thumbs up, a heart. And if you have anything you want me to specifically touch on today on the show, I will make sure I address that. So I am watching, I am listening, and I can't wait to hear from you. I'm ready when you are, man. Yep. Awesome. Welcome back, everybody. You're listening to the Maximize Living Radio Show. My name is Dr. Nick Barnes, and I am your local Max Living chiropractor here in the St. Louis region, bringing you guys truth about health and healing over the airwaves. My clinic is called Health From Within Family Chiropractic. Our website is healthfromwithinstl.com, healthfromwithinstl.com. And if you're just tuning into the show right now, on the first segment, we really talked about the 5 essentials and how we got to be focused on health promotion in our country, not just sickness and disease. And so my hope and prayer for you is when you're watching this and listening to this, share this with everybody you love and care about. And if you're a patient, family member, friend, whatever it is, that there's hope in health and healing. There's hope when it comes to health and healing. And if there's hope when it comes to health and healing, if we apply action steps to that belief and that truth and that fact that our body is designed to heal and that you are fearfully and wonderfully made, then our body will experience health and healing. And we can do everything we possibly can to avoid surgeries, to avoid medication use. And you know what? Who wants that? Everybody wants that. We talked about the 3 camps of people being in right now in our culture when it comes to health. That one camp is you're being proactive with your health, that you're doing everything you can to take responsibility for your health. That's where I hope all of you are. But I realize in our culture that's just not the case. There's another camp where people are reliant on surgeries and medications to get them through health. And that's not going to do anything but just maybe save your life, right? And keep you in a sick care, broken system. And so if you're in that camp, I'm telling you, no matter how far gone you think you are, no matter how old you think you are, there's still hope for you, right? Because we see it happen. We see people in their 90s healing in our clinic. We see people in their 80s getting off medication because their doctor said they don't need it anymore because they're just so healthy. They're just so healthy, right? And then we have the people in that middle camp where you're maybe straddling the line where some days you want to be healthy, but it's just too hard. So then you rely on medications, or you blame it on your genes or your age or whatever it is. No matter what camp you're in, guys, there's hope. There's hope. And so I'm here to tell you that right now, your body is working for you on your behalf. Whether it feels like it or not, you're designed to heal. You are fearfully and wonderfully made. And that the fact is, the truth is, and science proves that literally every single millisecond, there's a symphony of cellular reactions happening in your body right now on your behalf. And that is what I call as grace, right? When your body has to respond to the environment that you place on it, and it's going to respond in a positive way for a long period of time, that is called grace. When we think about the body's ability to do what it's supposed to do and you not having to will it, that is called grace. So what I'm here to tell you is that there's hope. But I'm also here to tell you that if there's a symptom that you have that you've never dealt with, if we ignore it, it will continue to get worse over time. If you medicate for it, it will be a short-term relief, and the underlying cause will continue to get worse over time. And then thirdly, you can actually, if you have a symptom, you can actually ask more questions and figure out what's causing it. You can actually ask more questions and figure out what's causing it. Why is that so important? Because at the end of the day, the only way you will actually experience true health and healing is if you're sensitive to what your body is telling you, and you start to look for the cause of your symptoms and address the cause of your symptoms, hopefully preventatively without drugs or surgery. Therefore, your body has the ability to heal itself for as long as you possibly can. And that is the goal. That is called health. And health means to heal and function 100%. It's not the lack of sickness, symptoms, or disease. If we want to keep looking for Band-Aid care or cover-up care, that is what the sick care system is focused on. You guys, you do not have high blood pressure because you're lacking blood pressure medication. You don't have high cholesterol because you're lacking cholesterol medication, right? You don't have low testosterone because you're lacking testosterone pills or pellets. That's not the case. And so once we recognize that, listen, there's medication and the medical model can save your life, but it's simply covering up a problem. You have high blood pressure because something else is going wrong in the body. You have high cholesterol because something else is not functioning like it should in the body. You have low hormones or low testosterone or hormone imbalances because something else hasn't been functioning for years in the body. And just now you're trying to treat it with pills, potions, and lotions. I'm here to tell you there's no way pills, potions, and lotions are designed to chronically get you well over time. It's just not going to happen. It's just not going to happen. Last segment we shared somebody who shared a patient's name. Her name is Lisa, who's suffering with migraines for years in her life, having 3 to 4 migraines a week. Her lifestyle was on point. She had the best trainer, the best supplements. She was detoxing. Every healthy lifestyle decision that you could do, she was doing. but she couldn't get rid of these migraines. Why? Because she was overlooking the one thing that's contributing to her migraines. It was her spinal column. We started to get her spine adjusted. Guys, I'm a corrective care chiropractor. Why am I a chiropractor? Because, listen, chiropractic changed my life. And I know it can change thousands of lives because we see it in our clinic day in, day out. So Lisa found damage in her spine. We saw that on the x-rays. We started to correct her spine, started to take pressure off the spinal cord of the nerves, and the body started to do one thing, which is heal. And guess what happened? When her body started to heal, her migraines started to what? Go away. See, I didn't treat her for migraines. I didn't heal her migraines. My adjustments weren't for her migraines. My adjustments were getting pressure off the spinal cord and nervous system and allowing the body to do one thing, which is heal as close to 100% as possible. And therefore, her body started to what? Heal from the migraines, heal from the headaches. It's unbelievable, right? So now she's a new person because now she's a better mom, a better wife. She has more energy. She's not relying on medication because her migraines are completely gone. And I asked this question, how many people are suffering with headaches, migraines, and they're just suffering with it? How many people are just suffering with headaches and migraines? And my heart breaks for people that are suffering with headaches and migraines. You know why? Because it's miserable. It keeps you from living your life. It keeps you from living your life. We don't want that to happen for people. You guys, that's why we're seeing people. That's why people call in from the radio show and come into the clinic and text in and come to our and be in our office, not just for them to get healthy, but for them to stay healthy because they want to actually experience a life of abundant health without drugs or surgery. Who doesn't want that? Listen, guys, I don't care if you've been to the chiropractor or not. It's time to go, right? It's time to go to a chiropractor and take care of your spine because it affects your nervous system and how your body heals and functions. And guess what? Chiropractors don't treat disease. They don't treat your sickness or your symptom. They don't treat COVID, right? Chiropractors don't exist to boost your immune system. We exist as chiropractors, and why we exist in our clinic is to take pressure off the spinal cord through chiropractic adjustments, allowing the signals from the brain to get to the body at 100%. Therefore, as a result, what happens is your body starts to heal at a better rate. Your immune system is improved and supported. Your tendency to have allergies and asthma goes down. Your blood pressure goes down. That's a medical research study that shows that. And why is that happening? Not because the adjustment treated the symptom. The adjustment take pressure off the nervous system, allowing the body to do one thing, which is heal itself. Heal itself. And once that happens, once you believe that to be true, and it's a fact, it's not a religion, it's not just a belief, it's actually a fact, then what happens is the body does one thing for you. It starts to heal abundantly. And now you start to develop, this is what's really cool, you start to develop a new normal. When you start to develop a new normal of health and healing, then you guys, that's when you experience life in its fullest. Stop living life with a dimmed light, man. If you have a dimmer on your life because you're sick and suffering and symptomatic, then I'm telling you guys this, that we got to turn things around. We got to turn things around. And I know you can. You know why I know you can is because your body's already fighting for you to be well. It wants you to be healthy. It wants you to heal. And many of you just haven't given it that thought, or your actions haven't aligned with that. You know what? It's never too late. It's never too late. Listen, we talked about the 5 essentials: mindset, nervous system, nutrition, exercise, detoxing. These essentials, these 5 essentials are what they are, which is they're essential for your health and healing. They're not just good ideas. They're essential. And so once we apply those to our life, our body starts to experience this new level of health and healing. And that's what's amazing about it. And so no matter how far you think you're gone, you're never too far gone. No matter how many medical treatments you've had, or no matter how many prescriptions you're on, you're never too far gone. I'm here to tell you that we've seen people who have a list of 10, 12, 15 medications, and they start to get healthy, and they start to lose weight, they start to feel better, and their medical doctor starts taking them off medication. We see that often. Why? Because the body's wanting to do it. It wants to heal for you. You know, every single week, I want to make sure not only that I give you information, but I want to give you access to awesome complimentary resources that we have. Why? Because you deserve it. You deserve to be well. And so these are complimentary resources. Go to our website. On our website, you can see news articles. You can see our upcoming events. You can see all of our supplements that we have. You can see our recipes. It's called Health From Within STL.com. That is the website, Health From Within STL.com. One of the recipes that's been super popular lately that people are wanting is how to make homemade bread. Right. So I'm going to get this recipe to you. In order to get the homemade bread recipe, all you got to do is pick up the phone and text in your email address, and we'll send you this recipe. The number to text in right now to get the homemade bread recipe is 314-323-7214. It's 314-323-7214. You guys, we're here local to serve you. We're located right in the heart of Rock Hill, Missouri, at the corner of Manchester McKnight. We're next to Starbucks, Steinmart, Club Fitness, that whole plaza right there. And so we are seeing right now, we're seeing new patients, even through the COVID junk that's happening out there. We're seeing new patients. Of course, we're taking precautions when it comes to the CDC guidelines, just because we're mandated to. That's fun. But we're seeing people with new patients coming to the clinic, getting healthy, getting well. We're seeing patients that have been my patients for up to 11 years right now, continuing to help their immune system stay strong with the 5 essentials that we teach and preach, and people living that. And so, yeah, guys, I mean, of course, as I said, we're taking precautions, but we are open. We're seeing people. We're actually open up extra hours to help more people to adhere to the 10-person rule. And of course, just make people feel more comfortable and safe. And so, I just want to make sure you guys know that we're here. We're here to serve you locally. And one of those patients that was listening to the radio show a couple weeks ago, his name is Brian. Brian came into the office. Well, he called in from the radio show and said, "Hey, Dr. Nick, I'm having high blood pressure. It's out of control. And I'm having these sinus and allergy headaches." He's like, "Do you think you can help me?" I go, "Well, what have you done for the sinus and allergy headaches?" He's like, "Man, I've tried everything. I've tried the neti pot. I've tried essential oils. I tried spraying crazy stuff up my nose that was apparently healthy and holistic. I've tried taking cinnamon and turmeric and curcumin to help with my blood pressure, but nothing seems to be working." He goes, "I was listening to your radio show and my wife forced me to call." I go, why did she force you to call? And he goes, "Well, she's tired of me complaining to her." I go, "Yeah, I hear that quite a bit." And so when Brian came in, we did a full exam of his spine. We checked out his posture, range of motion. We did a digital nerve system scan. We did a full set of x-rays along his spine. And we saw in his neck that he had a past whiplash injury when he was a teenager. And it started to develop into arthritis and bone spurs into his neck. And therefore, the bone spurring and degeneration was happening in his upper neck. And the nerves that come out of the upper neck, they're what affect the allergies. They're what affect the sinus cavities. Those are what affect the head. Those are also the nerves that affect blood pressure and the cardiovascular system. And so what's crazy is that what happened is what we saw damage in the spine. And so we said, if we start to take damage off the spine, start to restore the curvature of the neck and allow the body to heal, then what we see is that blood pressure starts to normalize and headaches start to go away. And so I'm not going to treat you for the headaches and blood pressure, but we're going to get your body healing. And so we started to adjust Brian's spine, started to adjust the cervical spine. And what's amazing is that in the last few weeks, his headaches are completely gone. He's a healthier person now. He goes, "I don't know what it is. It may be placebo," which, by the way, it's not placebo because I'm actually adjusting his spine. But I feel so much better. This is amazing. And my blood pressure numbers, I'm watching them, are decreasing. And so I'm scheduling an appointment with my cardiologist next week to get these reduced. And the cardiologist is super excited for me. And so I wonder how many people are listening right now who are suffering with sinus headaches and/or blood pressure, and you want to see if chiropractic can help you get healthy overall. And if you're listening right now, normally to come into our clinic, it's $150 for a new patient exam and X-rays. But if you call in right now, it's only $60. This is the catch. You just got to pick up the phone and call. When you call, I will answer the phone. We will schedule you for a new patient appointment, and we'll take the $60 payment over the phone. That way, when you come in, there's no additional cost whatsoever. The number to call right now is 314-323-7214. 314-323-7214. We'll be right back after the break. What's up, Facebook? Thanks so much for tuning in. Share this with everybody you love and care about. Make sure you comment. I'm looking at all the comments here and what you're listening. If you want me to cover a specific topic, I will definitely do that, either on the show or later on. But I appreciate you guys tuning in. Okay, this information is going to change lives, and I truly believe that. At the end of the day, who's responsible for their health? You are. You are. So let's do everything we can to push the needle in the right direction.
11 minutes.
Perfect.
Right?
You're right.
13, 14, 11.
Yeah. Welcome back, everybody. You're listening to the Maximize Living Radio Show. My name is Dr. Nick Barnes, and I want to tell you guys that my heart for you and my heart for people getting healthy and well is why I get up in the morning. That's why I do what I do, is because I want to see people experience health and healing without drugs or surgery. We are on a mission to transform healthcare, not from the top down, but from the bottom up. That means from our healthcare decisions and choices and the demands that we make to be available. And what's amazing is that when we see the patient be an advocate for their own health, that's when we see transformation happen. I mean, guys, when I first got in practice 11 years ago, there was only one health food store. It was Whole Foods, and Trader Joe's came along right behind that. But now you look at like Dearborn, Schnucks, Aldi's, Fresh Thyme, Lucky's Market that was once here, like all these different health food stores or healthy food chains have had to adapt with the health food demands, or they've had to just completely shut down and change their entire business model. And what's amazing is that I believe the culture has driven that. I believe the culture said, listen, I want more organic food. Listen, I want a whole health aisle. I want to have access to food that has no preservatives, no colorings, no dyes. We need that in our culture. And so I think the demand that was placed on the local grocers has really had to adapt to our demands. And so I believe that can happen with healthcare. I believe that, and I believe it is. I believe actually there is hope of this happening. And I know that because I know medical doctors and that are, forward-thinking people who are going against the grain in the system, and they're doing amazing things for their patients, and they're being patient advocates that before they jump on the bandwagon of just giving a prescription for an excuse. That's what's happening, right? It's like, you have blood pressure, here's a prescription. Like, guys, don't get me wrong. There's a need and a place for medication to save your life, but chronic use medication shouldn't be the first go-to. I get there's a need for that sometimes too, but it shouldn't be the first option. But as a culture, we've just said, I want a pill for every ill because I don't want to have to change. I don't want to have to change my lifestyle. I don't want to have to change my stress levels. I don't want to go out and exercise. I don't want to take a supplement. I don't want to do this, that, or the other. And so I think as a culture, human nature is I don't want to change, right? I mean, it's human nature. I don't want to change. I want to be convenient. I want to be comfortable, and I want to be cheap with my healthcare. And I'm here to tell you it's not working. I think people are recognizing that. And so for the people watching the show, listening to the show, or patients, that once we accept the fact that it's going to take an investment of health and healing, then you know what? Then I think that's what leads to action. That's what leads to action. And I think if we're operating out of fear, it's not going to lead to anything but paralysis. If we're operating out of knowledge that our body's designed to heal and function 100%, then what's going to happen is then our body will just do that. Our lifestyle has to support that. Our lifestyle and our exercise has to support that. This segment or the show, we talked about how Lisa is suffering with headaches. Her lifestyle is on point. Now her headaches are completely gone because she came to our clinic. We talked about Brian, who's suffering with sinus headaches. Lisa had migraines. Brian had sinus headaches, and he's doing better already. His headaches are completely gone. His cardiologist literally said, "I don't know what you've changed, but what I'm seeing is your blood pressure numbers are decreasing through what you're doing." And he didn't tell me he's going to a chiropractor, of course, but that's just stuff we see in our clinic where we're not treating people for symptoms. We're not treating people for blood pressure. We're not treating people for headaches. But what we're doing is if we're determining if there's structural damage in the spine, and we remove the structural damage in the spine, the body's going to function better. The body's functioning better. The body's going to heal better. That's just a fact. That's just what's happening, right? And I'm here to say that some people don't like that message. Some people don't think it's true. Well, you don't have to. It's not a belief. It's just what happens. Like, Listen, guys, some of you may grow up thinking chiropractors are crazy or chiropractors are quacks or whatever the case may be, but I'm here to tell you that if you go to the right chiropractor, you start to determine what damage in your spine and how to correct it, then your body's going to experience decreased inflammation and experience a healthier body. It is what it is. But at the end of the day, I think it starts with the symptoms that we have. Do you have symptoms? Are you dealing with those symptoms? Are you ignoring the symptoms, which a lot of people do? And symptoms are just a warning sign that something's going on. You got to ask more questions, right? Like, for instance, if your blood pressure is high, you can't just ignore that. You got to figure out, why is it high? Like, it's not that hard to do, right? Just figure out. You got to ask the question, like, hey, doc, why do you think it's high? Is it because you're stressed? Is it because you don't know how you're not sleeping like you should? Is it because there's damage in your spine? I mean, what is it? And so I think we got to recognize that we got to start asking more questions. The more questions we ask, the better answers we're going to get, right? And so what I'll tell you is you have to be an advocate for your health, because at the end of the day, your health result is a direct reflection of what you've done or not done in your health. It's not the doctor's fault. It's not the medication's fault. It's not the surgery's fault. It's what you've done or not done to your health. And I think there's power in that when we take responsibility. It's like, okay, well, maybe this is something I've ignored for years. Maybe I haven't known what to do with my health. Maybe I can do something different to yield a different result, right? Sometimes that's just changing what you're eating. Sometimes that's changing the supplements you take. Maybe that's getting an appointment in our clinic, right? Our clinic is called Health from Within Family Chiropractic. We're located in Rock Hill, Missouri, to corner of Manchester McKnight. Our website is healthfromwithinstl.com, healthfromwithinstl.com. And we're here to serve you locally. I mean, we see thousands of patients in our clinic on a monthly basis, hundreds of people per week, getting amazing results. And they may have came in not knowing what chiropractic is. They may have came in skeptics of chiropractic. You know what? That's okay. If you've never experienced what real chiropractic is, based off of the structure of your spine, what your x-rays look like, then you may not understand what chiropractic can do for you, right? You don't understand what it can do for your spine. But when you start to take your spine from damage to a healthy spine, and that's the goal, right? To where we're taking our spine from point A to point B with corrective chiropractic care, that's when amazing things happen. That's when the pressure is released off the nervous system. That's when the body starts to do what it's supposed to do, which is heal. And whether you believe it or not, I don't care. I don't care if you believe it or not. Experience it, then you can believe it or not, right? Experience it, then you can believe it or not, right? It's like if I were to say, like, I don't believe in surgery. I don't believe in cardiologists. That holds no weight. There's no foundation in that belief, right? Like, I don't believe chiropractic can work. Well, have you tried it? No. I don't believe in supplements. Oh, have you had your blood tested? Have you taken the supplements? Have you had your blood retested? You can't just say a statement, I don't believe in something, right? And listen, if you're going to look for double-blind studies, who's running double-blind studies when it comes to the medications, right? It's the pharmaceutical companies are running their own double-blind studies. It's not always about like, oh, the research. I care about that. Don't get me wrong, but you guys, we got to step back and say, listen, does it make sense to eat more green food than processed food? Yes. Okay. Does it make sense to exercise every day versus not exercising all? Yes. Does it make sense to have a healthy spine versus having a bad spine? Yes. Does it make sense that if your artery is 99% blocked, does it make sense to go in and get surgery to get the artery unblocked? Yes. Right? If your blood pressure is 200 over 150, does it make sense to take a blood pressure medication to save your life? Yes, it does. Right? There's common sense here too, guys. Right? The less stress is on this body, the better my immune system will be. Right? But one of those guys is a huge skeptic, and I love skeptics because they don't know what they're going to get until they come to the clinic. His name's David. David came to the clinic. This is about a year ago. David came to the clinic. He's a big golf player, and he was referred in by one of his golf buddies. And his golf buddy says, listen, I'm going to this chiropractor. His name's Dr. Nick. Listen to his radio show. Whether you believe it or not, you just got to go get checked. Go get checked. So David comes in the clinic. I go, David, so what's the reason that you're here? He goes, listen, my golf buddy told me to come. He goes, every year around this time, around springtime, when I'm working in the yard, my back goes out, and I have horrible sciatica that I'm literally laid up in bed for weeks. And so he goes, listen, I want to figure out what's causing my sciatica. I want to also figure out how to not have this happen to me ever again. And I want to beat my buddy in golf, right? Of course, he had to throw that one in there. And so with David, we said, okay, so have you had any traumas in your spine? Have you had any damage in your lower back? He goes, well, I played sports as a kid. I played college football. So I'm sure something's wrong with my spine. I go, have you ever had your spine checked? He goes, well, no. Every time this happens to me and I get into a spasm, I go to urgent care. They just give me a muscle relaxer and pain meds. I go, how's that working? He goes, well, it works for the time being, but the problem is he keeps coming back. I go, so how's it working? He goes, well, I guess it's not working. I guess it's not working. And so he's exactly right. It wasn't working. He was doing the same thing every year, expecting a different result. That's called insanity. And so when David came in, I go, man, if we can figure out what's causing this problem, do you want to see it? Do you want to see it improve? Do you want to really see it improve? He goes, yeah, of course I do. And so David went through a full exam. We got a full set of X-rays, and he never knew this, but he had disc degeneration in his lower back at L4, L5, L5, S1. Also, he had a minor scoliosis that no one ever told him about. And what we did with David, we started to adjust his lower back by taking pressure off the nerves and restoring the curvature in his spine and reducing the scoliosis. And what's amazing is David, within 3 months, David's sciatica pain was gone. He still has not had any sciatica till this day. His yard work has not been affected, so therefore he's able to spend more time in the yard. He doesn't have any pain anymore. He's not taking any medications anymore. And I think he did beat his buddy in golf, right? And so David's life is back. So how many people out there who are suffering with sciatica or lower back pain, maybe it's once or twice a year, maybe it's all the time, and they've never seen what's going on in their spine? This is the chance. Normally to come into our clinic, it's $150 for a new patient exam and x-rays. But if you're listening to the show right now, it's only $60. That's right. You save $90. This is the catch. All you do is pick up the phone and call. When you call, I will answer the phone and I will schedule you for a new patient appointment, and we'll take the payment over the phone. That way, when you come in, there is no additional cost whatsoever. The number to call right now is 314-323-7214. 314-323-7214. We'll be right back after the break, coming back even stronger. Thanks, Facebook, for tuning in. Share this with everybody you love and care about. Keep commenting, keep sharing. I will come back and answer any questions you may have. Have a blessed day. All right.